Welcome, Polina. Thank you so much for joining here. We are very excited to host your nonprofit cancer care, on the occasion of World Cancer Day. And we'd love to know your journey as the chairperson. How has a nonprofit grown? Why is it important to talk about cancer awareness in 2022? What are different programs that Cancer Care is running? And how can we support you? So, before getting started, I'd love to know a little bit more about you. How are you associated with cancer care?
Firstly, thank you very much for the invitation, and I'm very glad to be here today with you. My name is Polina Lajanska. I'm an oncologist, and several years ago, actually in 2018, we started a foundation here in Bulgaria that helps people with oncology diseases. The main reason for that was that in Bulgaria there wasn't enough systematic information about the cancer diseases following the patient's journey, and we don't have cancer plan for screening and for prevention, and this was really needed for our patients. So I am the chairperson of the foundation that is called Win Over Cancer, and we created this project cancercare.bg, that is the first platform in Bulgaria for the information that I've already said. After that, we started to organize digital awareness campaign and screening campaign for different locations of cancer. The biggest event that we organize here in Bulgaria is called Race for the Cure. It is supporting the breast cancer fight. And actually, we are part of a bigger organization that is called Think Pink Europe. It is a European organization, and it provides the knowledge and the know-how of this Race for the Cure event. The Race for the Cure event is also a charity event. I mean that we are raising funds for screening campaign for breast cancer, and of course we are making a great awareness campaign involving many celebrities, TVs and radios, and this is what are we working through the year. Actually, we have several digital awareness campaigns. We have some screening campaigns for prostate cancer, for breast cancer, sometimes for testicular cancer. We want to make the first screening campaign for lung cancer in Bulgaria, and we provide information by our platform, not only through written information, also through video content with some of the most famous oncologists here, and psychologists, and of course cancer survivors.
Great. It was really nice knowing your story. And can you just brief me a little bit about why this awareness about cancer is so important nowadays? Can you just tell me how do you feel about it?
Actually, this is very, very important of two main things. The first thing is prevention. It is very important that people are educated, that the prevention is very important. Cancer awareness is a great thing, actually. You may have the choice to lead, for example, a healthier life, and teach your children to follow it for minimizing the risk of cancer. And for example, people should minimize alcohol use, eat healthier, maintain a healthy weight, exercise more most of the days, quit smoking, protect their skin from the sun. These are very important things that may minimize the risk of developing cancer disease. Actually, according to World Health Organization, between 30 and 50% of all cancer cases are preventable. And early detection not only saves lives, but also reduce the financial and emotional stress of the treatment. And that is why knowing the early signs and symptoms are very important. Through awareness, you actually know what is a risk factor, what are your personal risk factors. If you have some family history connected to cancer, and you will know that you have to go to the doctor and to have screening tests regularly, for example. And this may save your life, of course. The other thing that why is so important awareness, screening. Cancer is often asymptomatic disease, and in the early stages, people may not have seen a doctor until it is the disease is progressed. And the best chance for a positive outcome is to follow recommendations for screening, so that we can detect early the disease, and some of the disease may be curable actually. For example, breast cancer, prostate cancer, they may be curable. Cancer awareness educates people about the disease and how important is its detection, because early diagnosis may also be good for the financial part of the country, of the government, because as the latest stages of the disease are detected, the most important is treatment. The most expensive is the treatment. The other important thing is that people know their their risks, and they may communicate it in the family with the children, and they teach the children to live better, healthier, and to know that there is such a risk in the family, and they may live actually longer.
I'm really interested, Polina, in what you mentioned, that how cancer treatments are very expensive, and which is why screening and education becomes a lot more important. So I just wanted to understand that how does a nonprofit navigate with this, since you deal with cancer care end to end for cancer patients? So how are the treatments meant with? What is that process like when you first speak to a patient, from the diagnosis till their treatment? What is that journey like in cancer care?
Actually, we just provide this awareness. We are not so much involving with the patient after they are diagnosed. We provide them psychological help through these stages. After the diagnosis, we are mostly focused on the prevention and the screening before the diagnosis, because, as I said, it is very important to know these things. And most of the people, especially in Bulgaria, they are very afraid to go to the doctor because the doctor might say that they have cancer.
Got it. And as you said, that they're scared that the doctors may say that they have cancer, but that is a bigger problem in itself. So the sooner it get diagnosis, the sooner it would get treatment. So it's this cycle that I think a nonprofit is trying to break. And I'd just like to understand a little bit more about what do you think is the difference between cancer treatments in Bulgaria versus other countries?
as medicamental part of the treatment, we are very good. We are as every other country in Europe, because we have all the medicaments, all the treatment plans. But here the communication between patients and doctor is very bad. Patients don't have trust in doctors and in the healthcare system here. We have a lot of misorganization actually in our healthcare system, and because we don't have one place that a patient have to go, for example, just one hospital where the patient can make everything as tests, and after that is treatment. This can cause very much time, and time is very important here. And the stress in patients that they don't have the right communication with the doctors is great, and they are really afraid, they're really depressed. And in 2 words, this is the situation here. Actually, the communication and the organizations here is bad, and it's not like in Western Europe, for example. And mainly, we don't have at all a program for prevention screening. And most of the patients come with late stage, and this is very difficult for them and for us to treat. And of course, the mortality rate is not very good.
You also mentioned like you provide psychological help all throughout the stages of cancer detection. Can you tell me how do you do that? Like how can I know the treatment is also important, but apart from that, the emotional help, the psychological help to the patient, to its family members is also very necessary. Can you tell me more about that? Like how is your organization helping these patients curbing these problems?
We have some psychologists that are specialists in oncology patients. We are working with them, and when people are reaching us for help, we directing them to this psychologist. We had actually a line, a free phone line that they may have a talk with some of these psychologists, not only the patients, also their relatives. And because we know that psychological health is very important for the treatment, and most of the treatments with psychological help are actually the end is better than if there isn't a psychological help. This is what studies says, and this is important. But also in Bulgaria, psychological issues and help are like a taboo. I mean, here people don't want to have this help because they think that if they need this, this means that they're crazy. But they are not. I mean, this is basic and very important, and we want to show them that this is okay to have a psychological help and some professional guy that is helping you through the path, and also to your relatives. So we have psychologists that we are working with, and if people are needed, if people need this, we guide them to them.
Absolutely. And that's actually very important because it's such a big disease. It really changes an individual and their family. So the mental outcome and the kind of problems people face are equally big, and that need to be taken care of. And I want to kind of now talk about the other aspect of it, that which is the lifestyle. Do you know if there are also lifestyle if choices that affect the disease, or the other, or if this disease could be taken care of or maybe cured through lifestyle? Are there any studies or any experiences that you've had in your awareness journey with the nonprofit?
If I have to say, now the most important thing is COVID. Nothing else is important and doesn't exist. And the other diseases like forgotten. And because of the restrictions of COVID, people can't go to screening tests, can't go to doctors just like that. And I think that this will affect many people because we'll see by the numbers, of course, maybe next year and maybe next 2 years, that the cancer rate will grow, I'm sure, because we don't have now any screening. And when I hope that it will be soon, but when COVID ends, I mean these restrictions ends, everything will be back to normal and will be good. But you ask me, is there something in the lifestyle that could change the rate? Yes, if we have this prevention that I was talking about. For example, here in Bulgaria, many people smoke. If they quit smoking, this would be very good. And I'm sure that the rates will be different then. And also, of course, if you go to check yourself regularly, and if you eat healthier, and if you move, if you have exercises, because most of the people work in offices and they don't have this movement daily, and they eat something fast because they're busy all the time. These things that are healthier, they're always better.
Okay, you have mentioned, we need to lead a healthier life. We need to stop doing things that might hamper our health. Likewise, if somebody wants to work for this cause, how can he advocate about this?
If people want to be part of the cause, their help is precious when they're, for example, volunteers for organizing some event, for involving other people around them in the event, in the cause, in the campaign that we are making. Many of the corporate companies now are involving the whole teams, and for example, in this Race for the Cure event that I've already told you about, they are coming with the whole teams of the company, and they are running and walking, and they're part of the cause, and we are raising money because of their help and because of them, and we use it for the screening campaign. Of course, everybody can help with some donation. This is every NGO. Every NGO needs this to survive and to do these good things. But the most important thing, I think, is involvement. People have to involve in the cause, in the things that we do, to share it in the social media, and to take part as volunteers.